So Tom, how do you feel about chairs with armrests as opposed to chairs without armrests? Does it make much difference to you?
I probably prefer with armrests.
Mm-hmm.
Yeah.
Because?
Well, it takes away some of the stress on my bad knee, so I can just alleviate the stress to some extent.
And when you're getting on and off chairs, when your knee was particularly bad, did you sometimes extend your right leg so that your left leg was doing more of the work?
Yes.
Yeah, I think that would be something for a lot of patients that I see who've had recent surgery. That's what they are tending to do. And then gradually, as they get more strength in their operated leg into weeks and months into the future, they will be attempting to have a more symmetrical body as they're going on and off the chair. So having the two armrests really does help with that, provided someone can use both arms, of course, allows that body symmetry as we come up and go back down again. And I guess sometimes also just having the armrests to guide you into the chair is helpful, because you don't want to be falling off the edge of the chair, which for some people where a chair doesn't have arms could be a risk.
I find it gives me confidence too sometimes.
Yeah. So if you were to just show us now how you would normally get up, so you're very much using your armrests, you're pushing up with them, using your legs, feet shoulder width apart, and that was obviously, it looked good. Did it feel good? Yeah. So one thing to consider is perhaps if one or both of our lower limbs is sore, our feet, our knees, our hips, what we might find that we're doing is using our upper body more. So using our arms, our hands more to help us up. And sometimes that can be detrimental because, of course, our hands might also have arthritis or some other issue. So I guess we have to think carefully about how we do it. We want to get as strong as we can in our lower body to help us get up. What do we do in the meantime if we have got that pain or discomfort or some other condition affecting our upper limbs where we don't want to be doing that too much? I think one of the things that we can do is actually make our chair higher, so we're not having to generate so much force through our legs to get up. I will show you what that looks like. I'll just grab a cushion. So as you can see now, I've popped a booster cushion on this chair. I'm sitting higher up in the chair. What we find is when we make a chair higher, we also need to bring the back forward. So what I would also do, if I was to sit on that chair, I would get another cushion or pillow behind me so that I've got back support as well. I'd probably get one slightly thicker than the one I'm using at the moment, and that way I would have a nice upright posture. I might also have to think about what was happening with my feet. Now, as you can see, my feet are on the floor, they're well supported. If I found myself sitting on something where my feet weren't well supported, I would have to really think, well, is this appropriate for me? Because I think it is important to have my feet well supported. If my feet are not actually touching the ground, I'm going to have an awful lot of pressure on the underside of my thighs, and I think that wouldn't be at all what I would want. If I needed for some reason to sit on a chair that was that high, I would probably also want to have some sort of footrest. And then I have to think, well, how will I get rid of that footrest when I want to stand up? So it becomes quite complex in that situation. And I guess that's where, for some people, it might be worthwhile in their lives considering a chair that's actually an electric chair that does both the recline function but also helps them to rise up. I guess the downside of that is if we use that all the time, we're not actually using our muscles, so it might mean that we actually lose some strength. In everyone's situation, it will be individual, and it's working out what's the best thing for the individual person.